I'm Dr. Patel. Welcome to my YouTube channel. I am a chiropractor here in South Florida, and today I'm going to talk about 5 safe and effective exercises that you can do for low back pain. So this is if you have chronic or acute low back pain and you want to get rid of that, if you want to strengthen your core, make sure you watch these videos. Now, I did say the word core, so what is that? Let's talk about core. A lot of people come into my office and they're like, Doc, I'm strengthening my core, but it's not getting better. Well, maybe you're doing the wrong exercises. So for you to get a better idea of what the core is, it's not just the abs. So imagine this little diagram here. Think about all of the muscles that surround your spine, right? So imagine these 2 little vegan marshmallows as your spine. And when you're doing just abs, all you're doing is strengthening in here. So now this doesn't look very stable, does it, right? But if you're getting all of the muscles, so if you're getting the obliques, the transverse abdominals, and you're getting the spinal muscles, the stabilizers, the multifidi, the paraspinals, the QLs, the glutes, the muscles into the pelvic floor, there's 27 or 29 muscles that make up the core. So that's what we're going to emphasize today. Now, before I go into these exercises, if you're looking at other YouTube videos and you're doing your own stretching or exercise regimen and you're not getting better, make sure you go see your chiropractor, your MD, or your orthopedic surgeon and get that thorough evaluation, get that imaging if you need it, if you're not getting better. So today I'm going to start with a pelvic tilt going into the bridge. Now this is the most basic, but if you can't get into that pelvic tilt, if you're not doing it right, then all of these other exercises are going to be useless for you. So starting with the tilt, and all of these exercises I want you to do on the floor. If you have a yoga mat, that would be better. Doing these on the bed sometimes, because it's a little more instability, can make it harder. So we're going to start. What I want you to do is take your hands, put them right under the arch of your low back, and then start by pressing your abdominal, your abs and your spine into your hands. So applying pressure on your hands. And so what I'm doing is taking my hips and tilting them backward. So once you get comfortable with that, try to hold that there for 10 seconds. My feet are relaxed, my shoulders should be relaxed. So we're going to do that again, holding here for 10 seconds. Once you get comfortable with that, I'm going to dig my heels into the table, squeeze my glutes, keeping that position of my spine. This is going to help you engage more of your glutes. You're going to feel this in your quads a little bit in the glutes, but it should be less pressure on your spine. You don't want to overarch or hyperextend. So go ahead and do 10 of those, holding each one for 10 seconds. Okay, exercise number 2, we're going to use that same pelvic tilt and do what we call a dead bug. This one is pretty advanced, so there's ways to modify it if you can't do it. And remember, a lot of these exercises shouldn't be painful. You don't want to do exercises that are provoking the pain. You want to ease the pain. So what the goal with these is to engage the synergistic muscles, right? So that means the muscles that work in conjunction to the spinal stabilizers. If your low back is screaming at you, you don't want to keep attacking it by overstretching, overstrengthening. So again, the goal here is to get those glutes and the transverse abdominals, the obliques, everything else start firing. So with this one here, we're going to start again. So if you're not really sure what the pelvic tilt is, I'm just putting my hands in the small of my back where the arch is and creating pressure, right? So I want to engage more from the lower portion of my body and not so much here. You don't want to be doing that. So now we're going to get into that pelvic tilt, and I'm pushing down, holding here. And now with the dead bug, I'm going to raise and extend opposite arms and legs. So as I'm doing this, making sure that my back isn't arching. I want to keep it flat as I'm moving slow and controlled motions. Now, if this is painful for you, what you want to do is regress, right? So make it a little bit easier. Start with that tilt, keep your arms up, and just move one leg at a time. You can raise it like this. If this is too easy, then you can start here, and instead of extending all the way out, you're just going to do little heel taps, right? Just like so. So again, these exercises should be painless. All right, this third exercise I call the lumbar rotations. This is going to get more of your obliques. So again, lying on your back. And we can go into regressions too. So ideally you want to start up here. If you want to progress, you'd start with your legs straight. But we're going to keep it easy in the middle. And we're going to start by keeping the knees together. So I'm squishing my knees. And again, starting in a little bit of a pelvic tilt. And again, if any of this hurts you, you want to find a position that you're comfortable, right? So keeping my arms down, keeping my feet up at 90 degrees, and I'm going to slowly rotate to the side. And again, this is a stability exercise. So I'm keeping my spine on the table, and I'm trying to hold it where I start to feel my muscles engage. I'm going to hold it here for 10 seconds. And then slowly come back to the center. And again, same thing on this opposite side. So as you see, I'm not twisting my butt off the table. I'm going to keep it on the table and slowly just feel the muscles trying to hold my legs up. And again, if this is too painful, you're going to keep your feet on the table and do it this way. And same thing, just trying to go as far as you can until you feel these muscles engage, holding here for 10 seconds. And then slowly back to center and slowly to the opposite side. If you feel like these are too easy, then again, instead of with your feet and your knees bent, you're going to go straight and then try to go to either side. All right, and exercise number 4, we're going to talk about a plank and a side plank. Now when you think of plank, you're up on your arms and your toes. Today I want you to try this on your knees, and it might sound like it's almost like a girl push-up where it's too easy, but the goal here is to strengthen the proper muscles, right? So if you're doing it up on your toes and you're on your elbows and your shoulders and you just feel all of the pain or the pressure in the shoulder, it's not doing anything for your core, it's not doing anything for your spine. So let's try it today. You're going to go onto your elbows and keep those elbows in line with your shoulders. And I'm going to raise my feet up, so a lot of the pressure is on my knees. And for me, this is easier because I can feel it in my core. I feel it in my lower abdominals. And I want to make sure that I'm in a straight line from my knee to my shoulder. So I shouldn't be sagging like this, and I shouldn't be hyperextending like this, right? So you want to hold it here for 10 seconds. And then you can slowly relax if you need to. The goal here is to slowly increase into that 1 minute hold, right? So you want to start with 10 seconds, then 15 seconds, 30 seconds, and then you can slowly increase it like that. The next exercise, you're going to do the same concept. So instead of doing a side plank on your toes, you're going to do it on your knees. And the goal here is to feel it in the side, the obliques, the abdominals, and the QL. The QL, the quadratus lumborum, is a spinal stabilizer and a pelvic stabilizer. So it goes from your lumbar spine to your hips, your pelvis. So again, same thing, keeping my elbow in line with my shoulder. I'm going to put my arm here so that when I come up, I'm putting all of my pressure on my bottom knee and my elbow. And I want to use this arm to make sure that I'm in a straight line. So I don't want to be turned like this. I don't want to be hyperextending like this, and I don't want to be sagging and just lifting with my arm like this. So you want to really bring your hips up and forward. And again, same thing, start with 10 seconds. If you can't do 10 seconds, do 5 seconds and do repetitions of those, and then slowly increase to a 1 minute hold. Okay, for exercise 5, this is called modified Superman or swimmer's exercise. So the goal here is for you to use these muscles in your low back, right? So the paraspinals, the QLs, these are the muscles that stabilize your spine. So we're talking about rotation, so that twisting, that bending, these are the muscles that are going to help strengthen that. So you're going to start on your stomach, and this one is very important, so make sure that you do this along with the other exercises. So you're starting on your stomach, and I'm just raising opposite arm and leg. And this one, you don't have to hold it. It's more of a functional exercise, so more movement that you get is more engagement. And I know a lot of you are going to say, well, how am I going to do this at home? I don't have, a table like this. Well, take a travel pillow. I know you guys travel. Put that face down, and then that'll help you to breathe. And if this is hurting your stomach or your back, you're going to take a small pillow and put it underneath your belly button. Make sure it's under your belly button and not under your hips. That way you're not hyperextending your back. The goal here is when you're face down, you're firing in that glute. So I don't want to be extending so much like this. It's just a small movement, getting that glute engaged. And relaxing the upper arms, but moving that lat. So try those 5 exercises. If you have any questions, comment them below and I will get back to you. If you know anybody else that can use these exercises, make sure you share this video and follow me on Instagram.